Hello, everyone, and welcome to our Monday Minute. Today, we are going to discuss the HHCAHPS survey impact on the value-based purchasing model that will begin January 1st of 2023. HHCAHPS is the home health surveys that are sent to your patients that contain 40 plus questions on that questionnaire about the care that they have been provided by your organization. There are 5 different outcome measures that will be calculated in the outcome measure calculations for value-based purchasing that are specifically related to HHCAHPS. Those 5 measures include personal care, communication, team discussion, the overall rating of the agency by the patient, and the patient's willingness to recommend the agency. These 5 measures, the last 2, the rating and the willingness to recommend, only contain 1 question each. The others contain between 4 and 7 questions, depending on which of the measures you're talking about. One of the first places to look to determine where you currently stand with the HHCAHPS survey results is the Care Compare website, where just last week, the HHCAHPS ratings, star ratings, and outcome measure calculations were published for the most recent time period of data. And so in looking at your own results on the Care Compare site, you will be able to determine the weaknesses, if you have any, in the individual measure calculations of the HHCAHPS surveys. And of course, those would be the very first place you would want to begin in education and focus for beginning to improve your results from HHCAHPS. If you determined that you're weak in all of them or multiple ones, what do you do now? The first place you need to start with education on that survey is not dragging all your staff into a room and trying to go through 40 questions on a questionnaire in one in-service. You need to break it down by outcome measure and look specifically at the questions from the questionnaire that are going to be utilized in the calculation of that individual measure. And then at the next in-service, take the next measure, etc. The reality is, unless your field staff and any staff member within your organization is aware of the questions on this questionnaire that your patients are being asked to complete, how are they expected to get a positive result or impact the patient positively to get a positive result if the field staff don't even know what the questions are? And so it is very important that you bring your field staff and any, again, staff member in your organization that is going to talk to a patient, interact with patients and caregivers, go through with them the survey itself, and help them to understand the questions that your patients are going to be asked and how they can positively impact the results. These 5 measures that I mentioned earlier that will be used in the calculation of the value-based purchasing total performance score make up 30% of your total score. So it is drastically important that your field staff understand the impact that these questions and outcome measures have, and that you have helped instruct them on what they can do with their patients to get a positive result. We are very thankful that you continue to take care of patients in these very difficult times, including staffing shortages, etc., that have begun to really snowball recently. We have been very excited to be able to see many of you in conferences, and hope that we will be able to continue to bring very significant, important education to the industry as a whole. Thank you all for all that you do for home health patients and we hope to be with you again soon. Have a fabulous week.